Well, did you know there is a new way to stop the growth of kids' cavities? It's just one of the latest efforts to help children prevent tooth decay, which remains the top chronic infectious disease among kids. In fact, nearly 1 in 3 children ages 2 to 5 years old in the U.S. are affected by tooth decay. So what you don't know about your child's little teeth could be hurting them. American Academy of Pediatric Dentistry President Dr. Jade Miller is here with me now to explain why it's so important to make a big deal about little teeth, especially during National Children's Dental Health Month. Thank you so much for joining me today.
McCabe, thank you so much for having me.
Now, first, Doctor, what is the latest innovation to help treat cavities and overall keep children's teeth in good shape?
Well, McCabe, as we realize, healthcare is constantly evolving, and technology, there's so many new things that are happening, and not only healthcare, but oral healthcare. And one area that has become a tool in dentistry over the last 18 months in the United States is utilizing a liquid that is antibacterial and applying it to early cavities to really help stop their progress. I think it's important to know that this liquid is not a panacea. It's not designed for permanent treatment of cavities in most situations. It's really designed as a tool to buy time until that child, who may be very young, is older, and that dental problem can be treated when they're older, and perhaps their behavior would be more allowing in the treatment of that. That name of that liquid is called silver diamine fluoride. Another area that I think is important for your audiences to understand is that it does have some negative cosmetic effects on the short term, and that is the affected area of the tooth, that cavity area of the tooth will turn black while the cavity process is stopped. Now that can be corrected when the more definitive treatment occurs, but that's just what's new on the horizon, what we have available in certain situations today.
That's interesting. No, thank you for sharing that with us. Now, do you believe that there is a gap between parental knowledge about kids' dental issues and actual action?
You know, having been a pediatric dentist for many years, I see in my patient families that gap every day. And I think that's our role as an educator in dentistry. That's my role as an educator, is closing that gap. And that gap is really understanding the effect of dental disease on baby teeth can have in the other areas of our lives, whether it's our whole general health or the effect they have on the permanent teeth. We know if untreated cavities on the baby teeth are allowed to progress, there's an increased risk of damage to the permanent tooth. Now that damage to the permanent tooth becomes a lifetime problem for that adult. So, you know, that is the area of that gap exists.
Absolutely. Now, what are some of the primary culprits in childhood tooth decay and oral health issues?
You know, some of the primary culprits in the very young population, we're talking an infant and young child, that would be putting a child to bed at night with a nursing bottle that has anything other than water in it. For example, formula, juice, milk, soda, all those have natural sugars or acids, and they can, when a child is sleeping at night, nursing on and off throughout the night for many hours, that gives the opportunity for those cavity-causing bacteria to wreak their havoc. So again, that's that young population. We want really to avoid putting to bed at night with a bottle with anything other than water. The other area is in that teenage group and young or older child group, and that would be with more and more consumption of carbonated beverages and sports drinks, sour candies. Now we have two downsides, the double whammy as we call it, the sugar contributing cavity causing effect and the acid causing to the weakening of the tooth effect, making the progress of the cavity much more of a problem.
Absolutely. Now, what are the dangers of tooth decay in young children?
You know, the dangers as we have described, the effect it can have on our general health, in that it can contribute, we know it can affect our general health and our permanent teeth. But in the general health category, we know poor oral health has increases problem with diabetes, increased risk of premature birth, and also increased cardiovascular problems in individuals with poor oral health. So, I think a key element to understand is what can we do to be preventive? And I think first and foremost, we need to start early. Prevention starts early, and that means seeing a child by age 1. The American Academy of Pediatric Dentistry recommends age 1 dental visit, and all the other pediatric healthcare organizations do as well. By starting at age 1, if in many cases